What's up, everybody? Matty Willz checking in for yet another episode of Wellbeing Wednesday with myself, Matty Willz, where we talk to different health experts at MetroHealth. And today we'll do just that. We'll bring in right now the one and only Tyffani Dent. She's a psychologist. She is the psychologist at MetroHealth Systems. And as like with all of you professionals in the medical field, I know you all have a ton of accolades and titles and all of that stuff. So just share a little bit about yourself, your journey, and what you do today.
Thank you for having me. Again, I'm Tyffani Dent. I am a licensed psychologist. I've been practicing for over 20 years. My experience has primarily been with dual diagnosis services to adults and adolescents in various settings, as well as just general mental health in residential, prison systems, community-based services, school-based, pretty much anywhere where you're going to find adolescents. I've been there. And then when it comes to adults, inpatient, community-based, and the prison system. So that's
perfect. Thank you so much for that. We just like to let the people know that we just didn't pull you off the street, and you have, all the prereqs that you need in order to have these kinds of conversations, plus to do whatever you do professionally. Mm-hmm. So we knew that already. But today we'll be focusing on mental and substance abuse disorders. About 9.2 million people have co-occurring mental health and substance abuse disorders, according to the American Society of Addiction Medicine. So without further ado, we'll just kind of get into these questions. Up number one, Mrs. Dent, I didn't clarify that. How often and in what ways do mental health and addiction overlap?
Well, as you said, about 9.2 million people have co-occurring disorders. And so what we end up finding is that we have some people who come into addiction because they're trying to find a way to cope with their mental health disorders. We have others who start with addiction and then that ends up resulting in additional stressors, contributing to some of their mental health disorders. And so we see a very large percentage of those that we see have both. Oftentimes we end up treating one and sometimes not acknowledging the other.
I can imagine that would be tricky to figure out all the time. Does it go off like, what they say to you when they come in, or is it just kind of like what you observe and what you think you need to address first?
What usually happens is that we start with what the person comes in with, right? Because when someone presents for services, they're presenting oftentimes for maybe one or the other. But a part of our process is a comprehensive assessment where we're going to ask about substance use. We're going to ask about mental health to be able to make sure that we're not missing something and that we're treating the client holistically.
Got you. So what are some of the challenges that you are presented with when you are treating both conditions simultaneously?
I think there's a few of them. One of the first ones, if someone is coming and saying, I am coming for my mental health, and then during that assessment, we find that there's substance abuse. They may not view the substance abuse as something that they need to address because they're saying that's not bothering me. That's not my problem. Other times we have people who come with the opposite. I have substance use. And when we then begin to recognize there's some depression there may be some anxiety, some trauma, and we want to address that as well. That's not what brought me in the door. So motivating clients to recognize that we need to treat both of those issues. And then we also trying to figure out what do we need to do first. If we have a patient who's coming in the door and they are using substances that will result in some type of withdrawal, we know that we first have to address the withdrawal because they're not going to be able to actively engage in treatment when you're experiencing those physical health symptoms. And then we have to acknowledge that at times, especially for people who have mental health disorders, who have histories of trauma, we have to acknowledge that substance use may serve a purpose for them, that it may have at some point in time help them cope with what's going on, help them to not face some of the challenges or the life experiences or the mental health conditions that they have. And so now we're saying we need to take that away from you. And so understanding that we're also going to have to look at replacing some of those benefits that you may have had from that substance use.
Yes. That's pretty deep because you go in for one thing and then, like you said, the patient may not even recognize that something that they're doing is a substance abuse. And then that just opens up a whole new can of worms in terms of I mean, just like you said, if you take it away, what could be the result of that? And then the one thing that you said that was really interesting to me was it might have been helping them deal with whatever they were going through, or at least at one point initially. So yeah, that's kind of deep right there, actually. So what does the treatment path look like for someone struggling with addiction and mental health issues?
Well, first, we need to recognize that everybody is an individual. And here at MetroHealth, we try to treat the entire person. And so, if you're truly treating the whole person, you're recognizing that no two people are exactly alike. And so, making sure that we are treating them as an individual, that we're recognizing, for some patients, it could be you have severe mental health issues and you have a lower level substance abuse, or you may have high on both of those. And so, making sure that we're treating you based upon your individual presentation. We also know that when they come in, they're often in crisis. That's usually what ends someone up in an inpatient setting, whether they, as an individual, recognize they're in crisis or someone else or some system support has identified them being in crisis. So we usually have to stabilize that crisis first. If you're coming in with more of a severe mental health crisis where we're looking at self-harming behaviors or some type of increase in your mental health symptoms, we know that we're going to have to do some stabilization before we can really delve into those other issues. And as a part of this work, we also are trading off sometimes with those coping strategies you've used. So, or those things, those triggers that increase your mental health symptoms or result in you lapsing back into substance use. So we're going to be talking about emotional regulation, stress management. We're also going to need to look at what does ongoing treatment need to look like for you? Because inpatient hospitalization is a start. Is oftentimes a foundation or a reset. It's not the end of treatment. And so we want to be able to identify those as well.
Again, this is Wellbeing Wednesday with Matty Willz. We're talking to Tyffani Dent, licensed psychologist at MetroHealth Systems. So I identify with this next question a little bit because I've never really been one to want to take medicine necessarily, and I've told my doctor flat out before, when I had some back things, I'm like, yo, is this the only way that we can get through this back pain that I'm having? And then of course he told me, well, you can exercise more. And I was like, all right, well, let me just get something for the pain right now, but then I'll incorporate that down the line. But the question is, how do you address reluctance to use medications for mental health treatment for those who do have substance use disorders?
I think one of the things is that there is this belief at times where we talked about in substance use of total abstinence from substances. And so when we're now saying that you've been using substances and we're getting you off of these substances that you have been misusing or illegal substances, but we're going to replace it with a substance, that abstinence only becomes that struggle. And so part of it is that we encourage patients to talk with the prescribing physician about their reluctance, including being open and honest at any point in time, whether it's with their MetroHealth prescriber or as they move on to services if they go outside of MetroHealth. We want you to be honest about your history of substance use, because at times that's going to impact what medications your prescriber may prescribe for you. We also want to acknowledge that for some substances, there are medication-assisted treatment, which means that we may be replacing that substance that you are using with another substance that's going to kind of manage some of those cravings and symptoms. And again, we're going to want you to talk to our addiction medicine specialists who are going to talk to you about the benefits of doing more of a medication-assisted treatment. But we want to acknowledge, there's fear and anxiety, and then also some rigid beliefs about if you've had a substance use problem before, that any type of medication becomes a problem for you.
I would imagine that would be a tough conversation for the patient to admit to. I'm sure there are times where they're not, very forthcoming and everything that they may be dealing with. And I'm sure, you can expound, but I'm sure that would kind of delay getting to the end of the road in terms of actually treating them, right?
Yes, I think especially when we're looking at stigma associated with mental health disorders and also just how society views substance use disorders, because part of ongoing substance use is this tendency to not be honest with those around you around the levels of your use. So we want to begin to have those open and honest conversations, educating about why it's important to talk to your supports, to talk to your therapists, your prescribers about your concerns about your mental health as well as your substance use, so they can better engage with you and partner with you as you're looking at mental health management and recovery.
Absolutely. Again, just real quick, I wanted to point this out to our viewers and listeners. If this information is serving you in any way, please feel free to pass it on to people in your life that you may think may benefit from it, even if it's not necessarily something that you need to take home and hone in on. I'm sure there's at least one or two people that you know that could use the information. So we encourage you to share that with them. Just a couple more questions, Ms. Dent. Are there ongoing treatment options, and how does a patient continue to stay healthy after initial treatment?
Absolutely. We recognize, as I said before, that inpatient is either a reset because there's been a lapse in services or you've come in crisis, or the foundation, that beginning of treatment for you. This is not the end all be all. As a part of your treatment services here at MetroHealth, when you're coming into our dual diagnosis inpatient, is we are working with you to assess what are your ongoing treatment needs. And we're looking at level of care, which means where do you need to receive services in order to meet your individual needs. And we're going to make those recommendations. And those can be residential treatment, dual diagnosis residential treatment. It can be a mental health treatment facility that offers all supplemental substance abuse, where we can look at outpatient services. So intensive outpatient services for either your mental health and or your substance use. We can look at also medication assisted treatment, which is that ongoing medication maintenance for your substance use. And we're going to work with you to identify what's best, but also what is realistic for you as an individual that's going to make it easier for you to engage in services.
So basically, y'all got options. Y'all got all the options. You got all the bases covered, and whatever path you need to take, you all are in good position to take that path. So we'll get you out of here with this one. And it's one that is super important. We often cover this with basically whatever conversation we have. But how can friends and loved ones support someone that they recognize as needing help for addiction and or mental health?
I think first is educating yourself and having realistic expectations as it relates to the difficulty sometimes in managing mental health and managing substance use. Being supportive also sometimes means making hard decisions, being honest about your concerns with the person who is using or is struggling with their mental health, knowing what the resources are in the community, being a part of their treatment. Here at MetroHealth, we really understand the importance of your natural supports, those people who are going to be with you regardless of if you paying them or not, right? So those natural supports are your people. And we want to make sure that those people who are involved in your life, who are invested in your emotional wellness and in your recovery, know how to best support you. So we're going to educate you. We're going to work with you. We encourage also there are support groups in the community for those who have family members and loved ones who are struggling with mental health or substance use, because it can be hard to support someone who's having so many challenges. So definitely educate yourself, be a part of their treatment, ask them what they need from you in order to support them in their recovery and in their mental health management.
Very profound answers for literally everything that we talked about. And often we hear the term, it takes a village, in reference to like raising a child. But we do know that anytime there's any kind of family loved one situation, then that person also needs a village, no matter how old they are. And you guys are obviously a great first step. But of course, if your loved one, your friend, or whoever is going through any of these issues, you just explained it so well. Educate yourself, be a part of the solution, be open, be honest with them, and hopefully, everybody will get across the finish line together. So again, Tyffani Dent, psychologist at MetroHealth Systems. That was fabulous. That was great information. We appreciate you. And I'm at some point we're gonna run out of doctors, so I'm sure we'll loop back around and holler at you again. at some point in the future. But did you have anything in closing before we get out of here?
I just want to say MetroHealth is here for the community. We are here to, again, treat the whole person, get you to your healthiest state, and support you in your journey. So looking forward to working with those in the community and to the opening of our dual diagnosis inpatient unit.
Dope. Couldn't have said it better myself. And I'll say this. I actually switched to MetroHealth for my primary care since we started having these conversations about a year ago, or maybe less than a year ago. So I stand by everything that you say about Metro. Every person that I've met over there has been fabulous, whether in these types of settings or when I'm actually in the building. So you guys do great work. So keep it up.
Thank you.
Thank you. Thanks again to Tyffani Dent for stopping by and hanging out with us. And stay tuned for another episode of Wellbeing Wednesday with Matty Willz. We'll talk soon.